Hi, my name is Vijay Verma. I'm Vice President of Product Management for TeleVox, and I lead the enterprise product portfolio. Prior to TeleVox, I was head of emerging tech and transformation for a large academic medical center and a long history of working in health tech prior to that as well. One of the main areas that I work for TeleVox is focus on building a portfolio of solutions that will help the patients all throughout the patient journey, and that's what you will see in what TeleVox offers in terms of relationship management over a care journey as opposed to transactional messaging. Patient relationship management is an up and evolving concept that TeleVox is introducing to the market. Our thesis is that patients deserve a strong relationship, just as we have a notion of a definition of a relationship in our personal lives. Personal relationships are with a trusted partner, conversational, it works for both parties involved. Our thesis is that patients deserve the same level of interaction and engagement model for their care as well. And this has become more and more important because the shift for the industry towards a value-based care, which requires a strong, trusted, two-way conversational channel that serves both parties involved. If the patient has to wait for a long period of time or the next appointment to answer their questions, it will likely impact the care in a negative way, which does not serve the care provider or the overall health ecosystem. So that's why what patient relationship management is a always on, conversational, persistent, and an actionable model that works for patients as well as the health systems, which has not always been the case in the past. Comparing patient relationship management to a traditional engagement model, there are two models that we can compare against. First is just a traditional model of engagement of we'll send you a reminder and we will give you an option to confirm, cancel, or reschedule. Or we will send you a nudge that you are due for your colonoscopy, we'll help you book it, right? These are kind of like traditional engagement models that have been in the industry for the long time. They work well for the hospital systems or the care providers because they are serving their metrics, right? But what they don't take into account is patients have a question. So they might be watching an ad on the TV and they just might think, hey, does this apply to me? What do we expect the patients to do in that case? Should they wait for the next appointment? Should they call in? Or should they send the message to the care team via email or another modality? And all of these modalities have their shortcomings. Patient relationship management, on the other hand, will offer them an always-on interaction model where they can go ask questions, whether that is around discovering of a care or booking a care model or seeking next step around their care continuum. All of that will be completely accounted for. And the other model to compare against is the EHR-driven engagement model. Those models tends to work well for existing patients through the existing digital channels, but we've all seen a big saturation in terms of efficacy of these models. If we look at almost every patient portal that the EHRs provide, there is a lot of energy that's spent by the hospital systems or the provider practices to get patients activated on the patient portal. But then if you look at the utility of the patient portal prior to an appointment or after the appointment is done, there is a huge taper off that happens, right? And this is just one of the data points where EHR-driven engagement or EHR-driven patient relationship management has not quite worked as well. Even if you look at your own mobile devices, you have at least 60, 70, if not more, mobile apps. Your notifications are already throttled by iPhone or Android. So inherently there is a limit to how much the patients are going to react to notifications coming from existing mobile apps. And another challenge that happens is most of the new solutions that are coming from EMRs, they are in the same digital models like mobile app and mobile and websites, and they tend to work well for patients who are already using these channels, but don't do enough to reach a wider range of patients or population, which is what's needed to have effect at a larger scale, right? So if you want to bridge the barrier, that's where you need a complementary solution set that multi-modality, whether some people prefer voice call or prefer the convenience of texting or prefer the convenience of chatting with someone as opposed to making phone calls, all of these experiences have to come together to bridge the gap that EMRs inherently provide to a solution. So if we start with a digital divide, like if we address, like how will we address digital divide or health equity, like we need a fundamentally different approach of thinking of providing access to care for our patient pool, right? We have to principally acknowledge that we have different behavior patterns, we have different preferences for even different channels, right? So the same example that I mentioned earlier, but let's take that in a retail experience. So if you're buying a TV, in all likelihood you will go to a website, you will shop around, compare 4 or 5 different options. But if you want to order a ride for yourself, you will use the mobile app to book a ride. But if you need to discuss a more complicated scenario related to an upcoming travel, you would prefer to make a phone call. So recognizing that different situations need different kind of interaction pattern for different patient population, we need to provide a completely different experience for our patients that is geared towards patients' needs and gives them the freedom of choice for different scenarios. And that's like one particular example of how TeleVox has done differently. All of our solutions handle multiple modalities to begin with. We are completely omni-channel. But even within the channel, I would say, like, we do each channel at a very different level. So SMS, for example, for us is not a one-way notification channel to get you to confirm or cancel or reschedule your appointment. We've established SMS as a customer service channel as opposed to a customer notification channel. So our patients can talk to their institutions using SMS just as if they could use any mobile app or any website. We will give them access to the same information, which alleviates concerns around their current state, helps establish the continuous conversation with the care team or with the institution, and gives them access to automated self-service, reducing the need to make a phone call to begin with, and eliminating extraneous workload for the staff of the hospital systems. If you look at the biggest thing that has happened in technology in the last year and a half is the use of large language models to principally handle languages or improve our understanding of what different people are wanting and expressing in a different channels, right? We don't need to, historically that used to be a manual effort to have content that worked for mobile phones, to responsive websites, to SMS. Now we can use these large language models to not only curate, but also understand the information or the questions that are coming from the patients without requiring a lot of manual effort. And similarly, in order to respond to these questions or concerns, now we don't need to provide content that is pre-created for different channels or different language scenarios. So this conversational AI as an is a one good example of a tool set that's available to all of us to improve the patient experience at scale without compromising the outcomes at heart. And similarly, extending the notion of AI to automation, we can automate a much larger set of tasks that were previously completely manual, right? And that was taxing for the staff. It leads to high burnout rates, high churn out, from the staff point of view. But from patients' point of view, it leads to poorer outcomes because typically the response times used to be much longer. and they did not lead to a positive experience. Now using this AI automation, conversational experiences, we can provide a lot more personalized experiences at scale, and that all of this goes a long way in establishing that the patient feels connected and stays connected to the care team as well as to the health institution. So what TeleVox does fundamentally very different than any other vendor in the market is that we provide a connected experience that has solutions that work for patients irrespective of where they are in the patient journey. Whether they are very earlier on in the care cycle where they're discovering care, or they're looking for care guidance in terms of should they go to urgent care or ER, or which provider should they see, is a video visit more appropriate for them or an in-person visit, and leading them off to, now let's say we got that appointment booked, helping them prepare for that appointment so they come up to those appointments, whether they're procedure or with a physician, more prepared and avoiding last minute surprises. And similarly, when the visit is actually done, they go back home with a strong sense of connection with the care team, with the right content, using the channels of their choice, so they can follow up with the right actions that are needed. And then we complete the loop in terms of any care gaps that are needed or acquisitions that are needed from a patient's point of view for the hospital system. So overall, it builds a big virtuous cycle around more patients coming into the practices, more patients coming prepared for those appointments, and better clinical outcomes all around. Now, while this sounds like operational clinical in nature, this is primarily with the patient in mind, because recognizing that patients need information and decisions and different level of interactions at various points in their care journey, and having them not rely on an anonymous source like a web search engine is essentially what will build that long-term trust, not only for the patients but also for the institution that is involved. So principally, like any business knows, happy employees lead to happy customers, and which in turn leads to the revenue growth that almost every business is looking for, right? So in this, I've talked a lot about how we are improving the patient experience. To summarize, that we improve the patient experience by leveraging high degree of automation, high degree of informing the patients towards where the right information is, and when both of these fail, connecting them to the staff who can best help them. So the one advantage that the staff already sees is that the obvious tasks that are needed, the common tasks are already automated and taken care of. So if it was a request for an appointment, or a request for a prescription refill, or a request for guidance on how to prepare for a procedure, all of that is already taken care of. So what's coming to the staff in this case is the set of patients who need that high touch and the personalized attention. But by freeing up the automatable tasks, we've given the staff a lot more leeway to take care of these patients in a personalized manner. And what you will also see from our solutions is that when the conversation is passed to the staff, whether that is in person or virtual, staff is given a personalized summary of who the patient is, why they are calling, or what might be the reasons they might be calling based upon their past or current or future appointments. So all of this makes the staff a lot more prepared to handle the patient at hand, and gives them a much better positive experience all around. Principally, the transition from patient engagement to patient relationship management is something that we will see a big shift towards, right? Recognizing that relationship management is a two-way street, so we have to factor in patients' needs 24/7 will be a big shift that will happen. And in order to do so, the platform providers or the solution providers will have to account for a couple of things. First is We have to make all our experiences omni-channel so we can reach more patients and not impose our technology choices or experience choices on the patients. So keeping it omni-channel is very important. Second is leverage automation like truly at heart. So lead with automation first, because that will ensure that the right interactions are being escalated to the staff that's necessary, and anything else is already accounted for. Third is smart SMS. Think about this like really hard. SMS for us is a conversational channel in our personal life. There is no reason why SMS should stay a notification channel in healthcare. So upgrading SMS to be a customer service channel, making it smart SMS, which is persistent, actionable, and conversational, will be a big investment that we will see in the coming time in our industry.